So I'm excited to talk to you tonight because this class is all about statins. It's the truth about statins. And the reason why I decided to do this class is because you guys are getting so much misinformation out there, and because with what I do in my career, I know that a lot of my clients are getting put on statins when they really don't need to be put on statins. And we're going to talk about kind of why I think that and why some people they might need to go on statins for a short period of time. We're going to talk about that. But I really started studying this. I mean, I've been studying it for a long time, but I really started studying it when my dad had a heart attack. So my dad in 2022 had a heart attack. And listen, his cholesterol was normal and he wasn't on a statin. So when they're making claims to you guys that, oh, you're going to have cardiovascular disease and you're going to get heart attacks if your cholesterol is high. Well, that's just not true. And I'm going to show you tonight the real reason why you get cardiovascular disease and why you have heart attacks and aneurysms and strokes. And so I really learned even more about the statin and cholesterol and how it affects your heart when my dad had a heart attack. So he's fine, by the way, now, but he had a double bypass. It was a pretty scary time. So again, if you guys don't know who I am, my name is Terry Dale, and I am the author of 2 Amazon best-selling books, and I do these classes for you every week so I can keep you guys informed, and I can give you the latest science, the latest research, and teach you exactly everything I'm teaching my clients that are inside my academy. And when it comes to diabetes, when it comes to hormonal imbalances, when it comes to any symptom that your body is having, it's never just one thing that's causing it. For example, you go to your doctor, right, and you complain of indigestion or you complain of heartburn. They're going to tell you, oh, here's a drug, here's an antacid, and it's because you have too high a stomach acid. Well, no, there's a bunch of different things it can be. And so when you go to a doctor, they're always looking at one symptom and they're matching the drug to that symptom. And I'm here to tell you that when you have a symptom, it's never just one thing. It's usually a combination of things that's causing it. So it's always good to get to the underlying root cause. So when it comes to statins, these are getting handed out like candy. This drug is just unbelievably popular. In fact, it's billions of dollars a year industry. So what are statins? Statins are a class of drugs used to lower cholesterol levels in the blood. And it works by blocking an enzyme that blocks your production of cholesterol. So when this enzyme in the liver, which is called HMG-CoA reductase, which is crucial for the production of cholesterol, when this is blocked, statins reduce the overall production of cholesterol in the liver, and this leads to the decreased levels. So here are the kinds of statin drugs. There's about 7 popular ones. This is the clinical name, and this is kind of the generic name that they put to it: Lipitor, Crestor, Mevacor, Zocor, Lescol, Provocol, and Livalo. So you guys have probably heard and seen some of these, and maybe you guys are even on these, but these are the most common ones. And the differences in them are just minute differences in how the drug stops the production of cholesterol. Very complicated, but they all do the same thing, just in a little different way. So the big question that remains is, why do the doctors want your cholesterol to be low, really? So when you think about why somebody is put on a statin, when somebody is put on a statin, when your doctor says you have to go on a statin, they tell you that you need to go on a statin because your cholesterol levels on the blood labs are high or out of range. So the real question is, well, why do they want to lower your cholesterol? So in the doctor's, the MD's mind, they think that high cholesterol is bad. That's why they want to put you on a statin. So my question always is, well, why do they want your cholesterol low? Because there's no proof that high cholesterol causes cardiovascular disease or heart attacks. Your doctors are telling you if your cholesterol range is above 190, the total cholesterol, sometimes it's even 180, they'll say, you need to go on a statin. You need to have your cholesterol low. So my question always is, why? Like, I always want to know the why. Like, is it really bad to have your cholesterol high? Like, is that really the facts? Is that the truth? Or do doctors just want to sell drugs? Well, high cholesterol, they tell you high cholesterol causes heart attack. I question that. Because my dad, I have a really close connection to this topic because my dad had a heart attack and his cholesterol was not high. So now what? What does that mean? Right? I was very curious. Like, he had a blockage, he had a heart attack, but his cholesterol was on the blood labs was normal. So now what? So that got me asking questions. In fact, my mom has high cholesterol, and she's not on a statin. I made sure of it. And my dad has low cholesterol, and he had a heart attack. And neither of them are on statins. Now, I will say that, and by the way, next week I'm going to talk about more of cholesterol, what that all means. But tonight I want to kind of stick on the topic of statins. But the reason why I'm bringing this up is because my mom and dad, their doctors both wanted them to go on statins, and I intervened and said, absolutely not. Once I got their blood labs done and everything, I'm like, no, you are not going on statin. And this is why. Okay. So just make sure next week you tune in, because I am going to talk to you guys about cholesterol, because I want you guys to be educated in your own cholesterol data. When you have your blood labs drawn by your doctor, I want you to understand what that means. So next week, I'm going to talk to you about this, because when you go to your doctor now and he tells you your cholesterol is 190, 200, 230, 2, whatever, he's like, you need to go on a statin, because they scare the bejeebies out of you because they think having high cholesterol is bad. And I'm going to show you tonight. We're going to talk about why it's not. And then next week, I'm going to give you more in-depth lesson on cholesterol. So you have to always understand the risk versus the benefit. Statins do lower your cholesterol, 100%. They absolutely do lower your cholesterol. But what I'm going to show you tonight is the risks of having low cholesterol and the risks of using a statin to do that. That's the question I want you guys to really understand. Because, yeah, the statins do work. But my question always is, what's the real reason why they want our cholesterol low? Because one, it's not proven that high cholesterol causes heart attacks. And two, our body needs cholesterol. So one other thing I can use my parents as examples, because they always, they're always coming to me because their doctors are always telling them to go on medications. In fact, my mom, this is my beautiful mom, by the way, she's 72 years old, and she has not been on a statin for years, because I told her, listen, you don't need to be, and I'll get into more of that next week. But the reason why I wanted to talk to you guys about my mom tonight is because when she was on a statin years ago, she had restless leg syndrome, and restless leg syndrome is a symptom of a statin. So this is about 20 years ago, right, before I started kind of getting into studying all of this, but she had restless leg syndrome so bad. And she came to me when I started kind of learning nutrition and learning about this. She came to me and she goes, Terry, I'm having such bad restless legs. And I'm like, it has to be a side effect of a medication. So she went off the medication, and her restless leg syndrome was gone in about a week. Side effects from the drug are a thing. And I'm going to explain to you why here in a second. I want to know if anybody watching this has any side effects from a statin. Post in the comments if any one of you watching this has some side effects, because I bet you do. I bet you do. And I'm going to go through them tonight, the list of side effects, but I bet you do. And maybe once I show you the slide of the list of side effects, you might even say, oh my gosh, I have that. I didn't even realize it was a side effect. I just thought it was normal. That was what my mom was told. My mom was told by her doctor, listen, her name is Paula. Listen, Paula, you're in your 60s, your 70s, you're getting older. It's inevitable that you're going to be on drugs. I think that's bullcrap, and I don't like that reasoning that medical doctors give you. Your body should not need medication if you take care of it and if you understand the body and how it works, and if you're giving it the environment where it can thrive. You should not need medication. Let's talk about side effects. So here are the short-term side effects of a statin. And when I say short-term, I'm talking like you start it and within days, you're going to feel these. And in fact, a few years ago when they wanted to put my dad on a statin, he did go on it without me knowing it, and right away he had muscle pain everywhere. He felt like he couldn't even he ached everywhere. And then when he finally shared it with me, I'm like, you need to get off that statin. So he's been, off of it. But after he had his heart attack, they wanted to put him on a statin too. And I said, absolutely not, because his cholesterol was fine. So the doctors are not explaining to you why cholesterol is not causing the heart attack. They're not explaining that to you. And I'm going to do that next week. But tonight, The short-term effects of the drugs are myopathy, muscle pain, liver damage, headaches, fatigue, sleep disturbances, dizziness, bowel changes, rashes, flushing, increased blood sugar levels. So many diabetics are on statins because their doctors are putting them on it because they think that the cholesterol is going to cause heart disease. And the statin is giving them higher blood sugars. It's turning into type 2 diabetes. Every time you go to a doctor and you have diabetes, they automatically put you on a statin because, again, they think that you shouldn't have cholesterol in your body. And I'm going to show you here in a little bit why you need cholesterol. Liver enzyme abnormalities, digestive issues, aches everywhere, nausea. Here's the long-term effects. So these are the short-term, within days, weeks. These are the long-term effects. So if you're on this statin drug for a long period of time, let's say a few months, years, you are going to get type 2 diabetes. You are going to end up with peripheral neuropathy. You're going to have lower K2 levels, which your body needs K2 in order to push calcium out of the blood, which is super important. You're going to have low testosterone. Statins deplete coenzyme Q10, which is a really important mineral that your body needs. It's going to lower your DHEA. You're going to have liver inflammation because the statin drug attacks the liver from producing cholesterol. And you're going to have increased risk of dementia. Your brain needs fat. It needs cholesterol. Increased risk for shingles. So many women, clients I know that were on statins would get shingles a lot. Well, this is one of the long-term side effects. Hair loss and an increased risk for cataract. So anyway, those are the long-term effects. They also have psychological effects. So depression, anxiety, irritability, aggression, nightmares, decreased concentration. So again, long-term side effects of statins will eventually and could potentially cause those. So muscle damage, liver toxicity, diabetes risk, cognitive impairment, drug interactions, gastrointestinal issues, neuropathy, hormone effects, fatigue, inflammation. Why would you want to go on a statin? Now, another thing, there is not one single peer-reviewed research study proving that cholesterol causes heart attacks. So why are they putting you on a statin? Why, if there's not one single peer-reviewed research study proving that cholesterol causes heart attacks or cardiovascular events, why are they wanting your cholesterol low? Because they're not understanding what cholesterol does. Here's the facts on cholesterol. Our body makes 3,000 milligrams a day. It makes it. So if they're putting you on a statin to decrease our body's own ability to make it, why would they do that? When God made our bodies, designed our bodies to make cholesterol. So why do we need a drug to decrease it? In fact, our liver makes 1,000 milligrams a day and the cells make 2,000, which is a total of 3,000 milligrams a day. Our own body makes that. This is not you eating it. This is our body makes it, you guys. That's how important cholesterol is. Now, when you eat cholesterol, if you were to have 1 pound of butter, 14 eggs, or 300 strips of bacon, that is equivalent to the amount of milligrams your body makes on its own of cholesterol. So think about this. If cholesterol is so bad for you, why does our body make so much of it? And then why do the doctors want to put you on a statin to reduce it when your body desperately needs cholesterol in every cell of the body? Because they don't know. They want to put you on a statin because it's a billion-dollar industry. Cholesterol is essential for every cell membrane structure and function. It's a crucial building block in cell membranes, contributing to their structural makeup and modulating membrane fluidity. Number 2, cholesterol plays a vital role in the production of important biological compounds. You need cholesterol in order to make vitamin D work better in the body. You need cholesterol to produce hormones like cortisol and basically DHEA or testosterone and progesterone. You need the body to make cholesterol for your sex hormones, for your steroid hormones, and to help you to synthesize vitamin D. So if you're on a statin and you're not able to do that, it's affecting your hormones. No wonder why women feel like crap. No wonder why men too, but I'm just talking to you women today, but no wonder why you guys feel like crap. Cholesterol is needed to make bile salts, which are necessary for the digestion and absorption of fat-soluble vitamins A, D, E, K, and K2. bile is stored in your gallbladder. So if you need cholesterol to make bile salts, which the bile is stored in the gallbladder, and you're not making them anymore, it's going to affect your digestion because bile helps you break down fats. It helps you push toxins. The bile helps you push toxins through the body. So if you're not making those, you're not going to absorb fat soluble vitamins and you're not going to be able to have complete digestion. Very important. Number 4 is involved in the crucial cellular processes. Okay, so it helps send important signals throughout the body, and it also helps other molecules to transport them through the bloodstream. So again, why are we not wanting cholesterol in our body? I'll get to that. Cholesterol is found in every cell of the body. Every cell. So cholesterol is packaged into lipoproteins, LDL and HDL. You guys have probably heard, when you get your blood labs done at a doctor, they always do the total cholesterol, and then they have LDL and HDL. And they always tell you that the HDL, which is the good cholesterol, and LDL is bad. But LDL and HDL, they're actually transported through the bloodstream to reach every cell in the body. And number 7, without cholesterol inside of these cells, it's going to lead to diseases, including cardiovascular issues, neurodegenerative disorders like dementia, Alzheimer's. Okay, so again, why do you think there has been an increase in dementia and Alzheimer's? They've linked that to statins because your brain is not getting fat. It's not getting cholesterol, and every cell in the body needs it. So your eyes, your brain, your skin, super important. Cholesterol is needed for proper function of all these areas of the body. And these are just the organs. We're talking also the cells. So how your body produces and transports cholesterol is when your liver makes it, it's going to be transformed into LDL, and then the LDL carrier puts it into the cell, and then when it gets in the cell, the HDL is to remove the excess cholesterol from the cells, and then it goes back to the liver through bile salts and converts to HDL. This is the process of how cholesterol works in the body. So again, why is it that we want a statin to interfere with this very important process? Cholesterol does not cause heart attacks. Cholesterol does not cause heart attacks. Cholesterol does not cause heart attacks. There is not one peer-reviewed study that proves cholesterol is the cause of it. Here's what's the cause of it. Are you ready? Cholesterol doesn't cause heart attacks. You know what does? Inflammation. The inflammation of the artery walls due to diet, stress, and other inflammatory toxins in the body. The inflammation in the arteries is what causes plaque to build up because cholesterol goes in to try to heal. And when you have inflammation, that's when the cholesterol cannot go through the body. The bad cholesterol attaches to the inflammation of the cell. I'm going to go into this next week. I don't want to talk about this tonight because it's a whole separate class, and I really do want to give you a really good understanding of it. But when you have inflammation in the walls of the arteries, okay, that inflammation is, think of it like when you have high blood sugars and when you eat bad foods, right? You're causing these little tears, these micro tears in the artery on the walls. And so what cholesterol does, it goes in and tries to repair the damage. And that's when it starts to build up. Now, if you don't have inflammation in the arteries, the cholesterol goes through normal and our body takes care of it and it doesn't even matter. Okay, so it's the inflammation that's causing the plaquing and causing the arteries to constrict, the plaquing and the narrowing of the artery. It's the inflammation. It's not cholesterol's fault. Okay, so I really want you guys to come and join me next Wednesday when I'm going to actually give you a better understanding of cholesterol and kind of how it works in the body so that you can be better informed, so that you can go to your doctor and you can say, listen, doc, this is what I know to be true. And I'm going to talk about some other tests you can do to have these conversations with your doctor because, listen, your arteries are not clogging up because you're you're eating healthy and because you need a statin. When you eat crappy food, bad oils, those are causing inflammation in the arteries, and the cholesterol is doing its job. The cholesterol is doing its job. The HDL and the LDL, by the way, you have two versions of LDL. You have a bad LDL and a good LDL, right? It's only the bad LDL that we need to be concerned about, and that's all dietary. Bad LDL is 100% dietary. And the bad LDL is the part of the cholesterol that's going into the inflamed tissue. So the bad LDL is what's going to the inflamed tissue. The HDL, the good LDL, all of that, if there's no inflammation in there, it's not a problem. It just goes right through. So you got to clean up your diet, and you got to understand this stuff, and you got to have these conversations with your doctor. So listen, here's what I do want to tell you tonight, though. If you are on a statin, you should not stop taking your statin unless you have an alternative lifestyle and nutrition plan, a plan to reduce your bad LDL. So a lot of times this is what happens. Like people will come and they'll talk to me and they'll be like, "Oh, Terry said I don't need to be on a statin." Listen, no, you don't need to be on a statin. However, if you don't have a plan, if you're not understanding what's causing the inflammation, if you don't know for sure if you have plaquing or if you have already have some inflammation in your arteries, then you need to find all that out first before you get pulled off a statin, because your lifestyle is going to dictate whether or not you continue on a statin. Because if you know what to do, your body's not going to, you're not going to need it. It is a lifestyle decision. But if you're not willing to learn what that is, the right foods to eat, if you're not willing to learn the lifestyle that it takes to lower the bad LDL and to change your diet, then you need to stay on a statin, because otherwise the inflammation in the arteries is going to continue to happen. But the inflammation in the arteries is not due to cholesterol. Just so we're clear, the inflammation in the arteries is not due to your cholesterol. So the goal is to become healthy, to be able to avoid inflammation in the arteries, which inflammation in the arteries is what leads to cardiovascular disease. So if you are on a statin, first of all, don't go off of it unless you work with me, find a new doctor, change your diet, lower your triglycerides, know how to lower your insulin, know how to lower your inflammation. You do not want to go off a statin unless you have a plan, is my point. So if you come and work with me, I'm going to show you how to do it, so you don't need to be on a statin. Because everything I teach will give you the right tools so that you can manage your health through your lifestyle, not through medication. I'm not a fan of medications, as you guys are finding out. So again, when you go to your medical doctor, what they're doing, when you walk into that office, they're doing blood work and they're doing an exam, and you get, 15 minutes with them? But what they're doing is they're asking you, what's wrong? What are your symptoms? Let me look at your blood work. And if there's something that's off in the labs for them, if your labs are not incongruent with what they think their ranges should be, what the range should be, they're going to put you on a drug. They're going to match the drug to the symptom. They're going to match a drug to what they think the imbalance is. That's just that's what they're trained to do. They're drug experts. They're not health experts. So what we're trained to do over in the Diabetes Lifestyle Coaching Academy is we will take a look at the labs that your doctor ran, and we will analyze them, and we will show you, like, this is how much inflammation you have. So let's lower the inflammation. Let's find a customized protocol, customized nutrition. Let's give you the steps and the tools and everything you need to do to reduce the inflammation, so you don't have to worry about having a cardiovascular event or having a stroke and a heart attack. Like, let's work on that. Let's run the appropriate tests to show us if you do have blockages. And if they are blockages, what can you do about it? You go to a doctor and they don't know how to tell you. The only thing they know how to do is tell you what drug to go on. And any drug that you go on has its risks. There might be a very short-term benefit, like the example for the statin. You go on a statin, yeah, it's going to lower your cholesterol, but we don't want our cholesterol low. We want to make sure that you have cholesterol in it, because the side effects and the diseases caused by not having cholesterol are way worse. So you have to decide, like, do you want to continue to eat like normally do and be able to do whatever you want to do and not learn this stuff and then be on medications for the rest of your life? Or do you want to actually learn how to do it right and get off medications? Those are your options. So I can help you get off statins, and I can help you become healthy so that your body doesn't need medications. That is what we do, and this is what the allopathic model is. Over here on the left, this is what your medical doctor does, and this is what somebody like Program or a holistic nutritionist like me, this is what we do. So again, what I want you guys to do is make sure that you next week, make sure that you come to the class. So I want to talk to you about cholesterol and arteries and blockages and all that. So you guys understand, because I think that if you understand this, you can go back to your doctor and you can have conversations with them. The more educated you are and the more you understand this stuff, the better off you are going to be.